We continue filming videos about the periarthritis of the shoulder joint. This is the second video. In the first video, we talked about which muscles undergo changes in scapulohumeral periarthrosis. Let's repeat once again. The main muscles are the deltoid muscle, infraspinatus muscle, supraspinatus muscle, serratus anterior muscle, and subclavius muscle. The pectoralis minor muscle and the rhomboid muscle. We talked about these muscles in the previous video. There we discussed everything, how their weakness manifests, what causes their weakness, instability of the clavicle, instability of the acromyoclavicular joint, and instability of the scapula itself. And now let's talk about why all this happens, the reasons, the causes that lead to the weakness of these muscles. Let's start with one of the common causes, instability of the acromyoclavicular joint. The reason for its instability is the difference in strength between the anterior deltoid and the posterior deltoid. And what happens is this joint simply becomes loose. This prevents the deltoid muscle from functioning properly. The second issue is instability of the clavicle, which is related to weakness of the subclavius muscle. Weakness of the subclavius muscle. The cause may be the injury itself. For example, a person might fall on their shoulder or arm, and this causes an injury at the attachment points of the subclavius muscle. This will later cause instability of the clavicle. Another cause of subclavius muscle weakness is compression of the nerve that innervates this muscle. The innervation of this muscle is by the 5th and 6th cervical roots. That is, these are the nerve roots that come off the spinal cord, then branch out and go to many muscles. Specifically, the 5th and 6th roots innervate most of the nerves and most of the muscles involved in stabilizing the shoulder joint. For example, the 5th cervical nerve, that is the 5th one, comes out below the 5th cervical vertebra. Let's count 1st, 2nd, 3rd, 4th, 5th. Here, this root, this is the 5th one, yes, and a lot of problems actually arise because of it. It also innervates the subclavian muscle, but that's the 5th and the 6th. Both innervate this muscle simultaneously. It also innervates the infraspinatus, supraspinatus, and deltoid muscles. That's quite a lot of muscles. Therefore, when this nerve root is compressed or pinched, which can happen at the level of the intervertebral foramen or at the level of the scalene muscle, it can cause problems. Here is the group of scalene muscles, anterior, middle, and posterior muscles. And all these nerve roots pass together between these muscles. And when this muscle shortens or goes into spasm, a tunnel syndrome occurs. Tunnel syndrome means that the nerve passes between muscles or between a muscle and a bone, for example, or some other structures. And when the muscle spasms or shortens, compression occurs. This nerve gets compressed. When the nerve is compressed, its nourishment is disrupted. Transmission of nerve impulses along the nerve is impaired, meaning the main function of the nerve, transmitting nerve impulses, affected. And if the nerve is a motor nerve, that means the impulse travels along this nerve to the muscle and makes the muscle move. There are motor nerves and there are sensory nerves that transmit sensation. Sensation can be different: temperature, pain, proprioceptors, which means sensitivity to the position of the hand and sensitivity to movement. Depending on the affected nerve, there will be a related impairment. That is, numbness, for example, occurs in a certain area, or there is a loss of sensation in some area. When a sensory nerve is irritated or damaged, motor impairment, muscle weakness, muscle atrophy, inability to move this particular muscle, inability to contract it. And it occurs due to mechanical compression or some other kind of damage. Well, right now we're talking about mechanical causes when some structures are being compressed. This happens specifically because of mechanical compression of the motor nerve, which is the one that carries impulses to the muscles. So there are actually a lot of problems specifically with the fifth and sixth nerve roots. So in this case, the position of the fifth cervical vertebra is especially important. And it's almost as if on purpose, it's exactly the fifth cervical vertebra. It is very often unstable. Its stabilization is disrupted. At the same time, a lot of important muscles are innervated by the fifth and sixth nerve roots. And it's the fifth cervical vertebra that is very often unstable. Well, a lot of attention has been paid to the atlas lately. That's the first vertebra, because it affects the position of the head. But essentially, when the first vertebra is fixed, for example, it gets locked in one position. But what will happen? Occipital nerve compression may be present. It's possible that in some position when turning, the vertebral artery will be partially compressed due to the muscles, specifically only because of muscle spasm, which will keep that vertebra in the wrong position. The muscle spasm may also result from weak long extensor. Well, basically, that's it. There won't be any more problems from the first vertebra. But with instability of the fifth vertebra or a change in its position, there will be quite a lot of issues. That is, there are a lot of muscles that specifically stabilize the shoulder joint. They will simply shut off and stop working. There will be weakness in all these muscles. So now we've talked about the subclavian muscle. The next muscle is the subscapularis muscle. There may be several reasons for its weakness. The first and most common reason is nerve compression, but here it most often doesn't occur in the intervertebral foramen or between the scalene muscles either. Well, that also happens often. Most often, nerve compression occurs because the infraspinatus muscle is mainly innervated by the sixth cervical root. And that's why its weakness occurs when the position of the first rib changes. When the first rib rises a bit higher than it should, when it goes up here, this causes compression of the sixth cervical nerve. Well, between the first rib and the scalene muscles. And all of this will cause weakness in all portions of the infraspinatus muscle. But most often, one of these portions is weak while the other two are short. Or, for example, two are weak and one remains shortened. If there is fixation of the first rib, or if the first rib is in the wrong position, you need to perform a manipulation on the first rib. Lower it down, and the manipulation is performed in this joint. And eliminate the shortening of the scalene muscles and determine why there is shortening occurred because of instability of the clavicle or weakness of the long neck extensors. Subscapularis muscle. The subscapularis muscle most often becomes shortened due to weakness of the infraspinatus muscle, but there are cases, rare ones, when weakness of this muscle occurs. This is due to impaired innervation. The serratus anterior muscle is the primary stabilizer of the scapula. Most often it becomes weak due to changes in the position of the ribs, due to fixation of the ribs, The ribs at these transverse joints due to changes in the position of the rib, because the rib stops participating in breathing. and the attachment point changes the place where the muscle is supposed to attach. The deltoid muscle itself can become weak. The posterior deltoid becomes weak because the position of the scapula changes the position of the attachment point of the posterior. The posterior part of the deltoid muscle changes. The anterior part becomes weak because of clavicle instability or due to injury to the muscle itself, just like the posterior one. There may be an injury to this particular bundle itself, or a trigger point at the attachment sites of this bundle. It can also become weak. The middle part weakens separately due to instability of this joint. If all three parts of this muscle are weak, then you need to check the innervation. This is the fifth cervical root. Again, here too, either at the level of the scalene muscles or at the level of the intervertebral foramina, nerve compression occurs. Let's pause for now. The main reason why this fifth cervical vertebra changes its position, becomes unstable, or develops some kind of fixation is the weakness of the long neck extensors. The long neck extensor is a powerful muscle that goes from the very base of the skull all the way to all the cervical vertebrae and attaches to all the thoracic vertebrae up to the sixth thoracic vertebra. The long neck extensor is like this. Where is the sixth thoracic vertebra? 1, 2, 3 here. It's a long muscle like this. A long muscle like this, meaning it doesn't end right here. It goes directly from the neck to this spot. And this muscle, this long, powerful muscle, it's supposed to hold the neck. If this muscle becomes weak, one neck extensor works, the other doesn't. That is, conditions are created for instability of the cervical vertebrae. With certain movements, one joint will move more than the other, fixation will occur, and all this will create conditions for nerve compression. The same thing, the antagonist of the long neck extensor is the scalene muscles. Here they are in the front. When the posterior muscle stops holding, its antagonist shortens. And between these muscles, between the scalene muscles, there are also conditions for nerve compression to occur. Therefore, in order to successfully treat a shoulder problem, limited movement in the shoulder or scapulohumeral periarthrosis, you first need to determine the cause. Why aren't all these muscles working? The cause of weakness in each muscle is determined. And very often, all of this is related to problems in the neck. So, in order to treat it, it's essential to restore both the neck muscles and the normal mobility between the joints of the vertebrae. Only after that should you move on to exercises. That is, before. For example, if you haven't restored muscle tone, it means you have nerve compression. The deltoid muscle isn't working. And if you start doing exercises right away,